Dr. Sujata.
Good evening, everybody. Since we
Please
are just
sit. I know, Ramesh, you don't need any clinical guidance, but
I'm not. My talk was directed towards trainees as well as people who wanted to start a training program on their own. But since all of us have training program, I don't know how much my talk will be relevant. The first, I will be covering my talk on why pediatric ophthalmology and neuro-ophthalmology, what to expect, where to do the fellowship, when and how to apply and structure of the fellowship. Some of it I think will be totally irrelevant. I'll be scrolling through it. So why pediatric ophthalmology? We all know kids' eyes are not miniature adult eyes. So we need specialized training. We have limited exposure in our residency programs to pediatric ophthalmology and neuro-ophthalmology. Then strabismus surgeries require special training. Pediatric cataracts not only requires training, but it is all about the follow-up of the cataract. Glasses in children is different. Some of the residents may like the subspecialty when they're reading different subjects. Some of the residents would like to continue institute practice, and pediatric ophthalmology and neuro-ophthalmology is definitely an important part of the practice. If you belong to a family of pediatricians, you would like to do pediatric ophthalmology, obviously. It is a relatively less saturated specialty, especially in the smaller C towns. Now B towns also have many pediatric ophthalmologies. The setup is less expensive as compared to the retina setups or say cataract. And multi-specialty children's hospital do need pediatric ophthalmologists. So there are always multi-specialty children's hospital coming up, and the need for pediatric ophthalmology is always increasing. So this was this interesting paper published in 2017 Indian Journal of Ophthalmology, which analyzed the prospect of pediatric ophthalmology. It was a questionnaire for the residents of 2013-2014. And some of the results which came up were nearly 70% of them responded that there was no structural teaching or posting in their residency program. And I think it remains almost the same to this date. 60% found that it was difficult to understand the subjects, and only 20% responded that they would like to do pediatric fellowship if they were given a chance. The major attraction was intellectual stimulation and independent operative skills, and the dissuading factors were difficulty in handling children and the stress factor involved. So why neuro-ophthalmology? Well, it's an integration of many subspecialties. So people with interest, doctors with interest in medicine, neurology, radiology, neurosurgery, who like doing teamwork, and who like racking their brains would like this subspecialty. And you can make life-altering diagnosis in neuro-ophthalmology. So at the end of the day, if you want to go home feeling good that you have altered the life of some patient every other day, so you can actually opt for neuro-ophthalmology. So what should a good pediatric ophthalmology fellowship offer? Apart from how to know how to deal with children, it should give you an extremely important skill of refraction or retinoscopy. And then there should be a training on comprehensive pediatric examination, pediatric and adult strabismus workups. Posting should be given in orthoptics, low vision aid, vision therapies, ROP screening, special children's clinic like cerebral visual impairment clinics, and they should learn how to dispense prisms, glasses, counsel parents. Initially, all these fellowships could have a little bit of comprehensive ophthalmology, and towards the end of the fellowship, they could have independent independent OPDs. The academic should be in the form of journal clubs, case discussions, seminars, presentations. They should be given research projects, case reports, and allowed to present their research in conferences. Pediatric ophthalmology is a broad specialty, so posting should be given in oculoplasty, retina for ROP screening, glaucoma, neuro-ophthalmology, all should be included in a pediatric ophthalmology fellowship. At the end of the fellowship, the fellow should have a rough idea as to how to set up a pediatric practice, child-friendly outpatient, collaborate with pediatricians and geneticists. And what about a good neuro-ophthalmology fellowship? Well, history taking, that is the crux of neuro-ophthalmology. So they should learn how to take a very meticulous history, learn basic neuro-ophthalmology workup, thorough training in ERGs and VEPs, thorough training in OCTs, a bit of neuroradiology, bit of neurology related to ophthalmology so that they can order appropriate systemic evaluation, because in neuro-ophthalmology, you have to order for a lot of systemic evaluation and you must know how to tailor it. And of course, the academics that I have already discussed. The neuro-ophthalmology should have postings in pediatric ophthalmology, oculoplasty, and glaucoma. And importantly, outside of the ophthalmology in neuromedicine, neurosurgery, and radiology. Ideal fellowship should have all of this. So when should you apply? Since there are no students, I'll skip over this. A little bit of cataract skill enhancement program. If you haven't been exposed to cataract surgery in the residency, which many of the residency don't expose children to, they can have a short skill enhancement program before they join the fellowship. Some of the states have bonds these days, but these bonds can be postponed till after the fellowship. Where to do the fellowships? Most of them have, most of the institutes have fellowship programs in pediatric ophthalmology. Most of them do include neuro-ophthalmology also. Like LVP has neuro-ophthalmology as well as pediatric ophthalmology. And most of the programs are 18 months. Some of them, like in LVP and AIMS senior residency, is for 3 years. And you can tailor yours according to your needs. Where to do the fellowship in neuro-ophthalmology? Only Chennai has got a 18 months fellowship. The rest have all short-term fellowship, LVPI and Arvind. How to apply? Well, how to tailor the intake of your students? Most of these institutes have initial MCQ examination followed by Viva. So if you want to run a program, you can tailor your MCQs in the specific subjects and then follow it up with interview. LVP has, Dr. Ramesh is sitting here, they have a graded staged interview process. And you can have 2 sessions, 1 sessions, depending on the need. So how to structure the fellowship? Well, I have given the structure of most of the institutes which have been running these fellowships for a long period. Shankar Nethralaya has a 18 months fellowship, of which 12 months will be with the pediatric ophthalmologist as a mentor. It may not be one mentor, it may be several mentors. Whoever is in the department as consultants will have the fellows posted with them in rotation. And you have a rotation in oculoplasty for a month, neuro-opthal for 2 months, retina for a month, and the last part of the program will be as a senior resident, where they get to work up their own patients and offer them surgery, and they will be allowed to do the surgery under the guidance of the mentor. It is a similar pattern followed by Arvind also. They have an initial general ophthalmology posting for about a month, followed by the pediatric ophthalmology. And all these programs will give you a posting in low vision and rehabilitation in ROP clinic for about for some period of time, in the neuro-ophthalmology clinic if it's a pediatric ophthalmology posting. And most will give you surgical exposures to squint, adults, and pediatric cataracts. LVPI has it a little different. They have advanced induction module in which initially they will have a basic subspecialty training, then they will be sent to the secondary postings for the next 1 year, and they will come back and will be in the advanced subspecialty training in their own department. If you have to model a structure of fellowship, these things are important, that you must have ancillary posting in low vision, in refraction, cycloplegic, the retinoscopy skills are very important in pediatric ophthalmology. So that is one thing which all candidates should be guided into. Low vision aid postings, postings in ROP screening are very important. To summarize, pediatric ophthalmology has very rewarding prospects. The structure of the fellowship should include all the things I have already spoken about. You can apply after post-graduation, but a short cataract training can be useful in the fellowship, and all major institutes do offer the fellowship. Thank you.
Thank you, Dr. Sujata. It was a wonderful presentation, and what residents and fellows, it was important for all of us to know how we can, upgrade our programs that we are offering in the different institutes that we represent. And I think with FICO also working towards some collective certification and all, maybe we all can probably pool in information and resources and probably try and create a system where we all, especially because there are very few, as you have mentioned, talking about pediatric ophthalmology and neuro-ophthalmology, probably bring about all our pass outs at a rather level so that it becomes good. But thank you very much. I think it was a learning experience for all. Any couple of comments, anybody?